Hi everybody, it's Mike with CHC Training. This video was produced by CHC Training, the nation's top environmental training firm. This video was designed to show you what PPE to wear, how to put it on, and how to take it off when dealing directly with a confirmed or a suspected COVID-19 patient. It is very important that all of the steps in this video are followed directly and exactly as shown, as this is as important to you and your health and safety as is the equipment itself.
There are 4 components of PPE described here. First is a gown or coverall with built-in booties and a hood. In this demonstration, we will be using a full-body coverall. Second are non-sterile disposable patient examination gloves, which are used for routine patient care in healthcare settings. These are appropriate for the care of patients with suspected or confirmed COVID-19. Third is a NIOSH-approved N95 respirator. Fourth are goggles or a face shield. In this demonstration, we will be using goggles. In this video, Danae will be demonstrating the proper way to don and doff the required PPE. Before we get started, you may notice that this video is not being filmed in a medical facility. This is done in order to reflect the real-life emergency response situations first responders may find themselves in, as this video is not only designed for medical personnel, but for all individuals who may be involved in pandemic response. First, please remove all personal items. These include any cell phones, pagers, jewelries, etc. The next step is to inspect the PPE to be worn. Individual PPE materials should be inspected prior to donning. It should be verified that each individual item is present without any invisible breaches. The PPE shown here is recommended by the CDC. If used correctly, this PPE is designed to eliminate physical gaps in coverage. Namely, no skin or hair will be showing. The next step is to perform hand hygiene. Hand hygiene should be performed by using alcohol-based hand sanitizer that contains 60 to 95% alcohol, or washing hands with soap and water for at least 20 seconds. If hands are visibly soiled, soap and water should be used before returning to alcohol-based hand sanitizer. To begin, PPE should be worn over scrubs or clothing. Put on the coverall. It should cover your entire torso from your arms to the end of your wrists. Find the zipper on the front of the coverall and zip up the coverall. Now, put on your N95 respirator. Healthcare workers wearing N95 respirators should have been medically cleared and fit tested prior to wearing a respirator. The N95 bands should be placed by first securing the bottom elastic band at the top of the back of your neck and the second elastic band on the crown of your head. Then, perform a user seal check of the respirator by pressing firmly on the malleable metal band located at the nose of the respirator to ensure a snug fit. Next, put on your coverall hood. The hood should cover your hair entirely. Make sure your ears and head are completely covered by the hood. Next, put on your gloves, ensuring that they are placed over your coverall sleeve for overlapping coverage. CDC does not recommend double gloves or extended length gloves at this time. Next, put on your goggles. The goggles should be put on over your hood. The goggles should fully cover the eyes with 360 degrees of protection around the eyes, including the sides. Now inspect the PPE. No exposed hair or skin should be visible at the end of the process. The healthcare workers should remain comfortable and able to move without restriction, while all parts of the body remain covered. Lastly, perform hand hygiene prior to entering the patient area. First, while still in the patient care room, the healthcare provider must perform hand hygiene on the outer gloves prior to exiting the patient care room. Remember that doffing of PPE is a high-risk activity. It is critical to move slowly and deliberately and in the correct sequence to reduce the possibility of contamination. Upon exiting the patient care room, immediately perform hand hygiene. Next, remove your gloves using the glove-in-glove technique. Using one hand, grab the outside of the other glove near the wrist. Peel the glove inside out. Holding the removed glove in the remaining gloved hand, slide 1 or 2 fingers under the remaining gloved hand over the removed glove. Peel the second glove off, rolling inside out and touching only the inside of the glove. Discard. Next, remove your goggles. Avoid touching the front surface of the goggles and lean forward as you remove the goggles. Next, remove your hood. Remember, your hood may be contaminated, so move slowly. Next, remove your coverall. To remove your coverall, place one hand on your navel and follow the zipper up to the zipper and unzip. Grab the coverall from the outside and pull it away from your body and down, turning it inside out as you pull. Avoid contact with your scrubs or clothing with the outside of the coverall, touching only the inside of the coverall. Remember, the outside of your coverall is contaminated, so move slowly. Perform hand hygiene. Next, remove your N95 respirator by tilting your head slightly forward and grasping first the bottom elastic band and then the top elastic band, and remove without touching the front. Perform hand hygiene. Next, perform one final check for visible contamination on your scrubs or clothing. In summary, doffing is a high-risk activity. Therefore, remove PPE slowly and carefully. Be meticulous in each step and perform hand hygiene, as it is critical to avoid exposure to contaminated materials. The steps shown in this video are based on CDC guidelines for healthcare providers who will be providing direct, intensive care for a suspected or confirmed COVID-19 patient. Again, this video demonstrates only one method for donning and doffing PPE.